Hello, everybody. Welcome to All About Health and Wellness. I'm Dr. Kevin Usriy. We're sponsored by All American Wellness Center. Give us a call at 561-863-8779 or see us on the internet at allamericanwellness.com. Today, we're brought to you by Podcast Junkies. That's podcastjunkies.com, Junkeez. Just simply give them a call in Boca Raton or look them up on the internet. If you're trying to get your message to the masses, you need to get in contact with Christian Perillo or Ben Castro, producer extraordinaire, and be able to get your message to the masses so that you can make sure that people are aware of what you do and what you have to offer the public. Today I'm going to talk to you about the ABCs of automobile accidents, and then we're going to introduce a special guest that I've been very fortunate to have with me today. If you are involved in an automobile accident, these are the most frequent issues that can create a problem for your health. You know, we all are dealing with a lot of different issues with our health. All you have to do is watch television for a few minutes, and you can see Big Pharma addressing their products to all of America that seem to have problems with their skin, have problems with autoimmune disease, have problems with mental health and diabetes, have problems with their gut. These are things that Big Pharma is trying to convince you that you have no other choice but to take these medications. The smartest thing you can do is find out whether you have a functional problem or a disease process. And make no mistake, if you do have a disease process, you do want to be able to avail yourself of the medical field. However, if you come to an applied kinesiologist, one of the wonderful things about this is you will find out in short order whether you have a disease process and need to, in fact, see a medical doctor, or whether you have a functional problem and have many options to utilize to get yourself at optimum health and wellness, and the applied kinesiologist can provide that for you. Remember that at All American Wellness, we offer a free 15-minute functional examination. If you're not sure whether you have a disease process and pathology or a functional issue, come on in. We will tell you in short order what it is that you're dealing with and what your options are. And remember, when you are involved in an automobile trauma, always make sure you go to see the chiropractor before 2 weeks have elapsed. According to state law, your insurance company that you pay your hard-earned dollars to every month are responsible to help you if you are injured in an automobile accident. And this is a no-fault state. Whether you were at fault, whether someone else was at fault, your auto insurance is responsible to take care of your auto-related injuries, provided you see a practitioner like a chiropractor before 2 weeks have elapsed. And you don't want to wait even 2 weeks. The sooner you start getting on top of these soft tissue functional issues, the less chance you're likely to have a permanent problem that'll follow you the rest of your life. Be sure to see the chiropractor and make sure that you always make your appointments regularly so you get over this problem and it becomes a distant memory of your past and it doesn't plague you continually. Enough of that. Today, I'm fortunate enough to have a very special guest with me, Dr. Sir J. Marienthal. The reason I use that title is Dr. Marienthal is a knight of the prestigious organization known as the Knights of the Round Table of Chiropractic. There are a lot of stringent activities and actions that you have to go through to become and obtain that honor of being a knight, and Dr. J has done that. Dr. J and I have known each other for about 9 years. We met when we were studying in a group to become diplomates in the International College of Applied Kinesiologists. This is a educational group that is worldwide. It has many different healthcare practitioners, medical doctors, chiropractors, osteopaths, dentists, homeopaths, naturopaths, and these healthcare practitioners from all over the world are being directed in many different ways by Dr. J. Marienthal. Dr. Marienthal is vice chair of the educational committee, which really is all about deciding all the education and all the things that are necessary for someone to be a qualified applied kinesiologist. He also is on the board of examiners, and again, it is his job to make sure that we have the highest educational standards possible, and we have Dr. J to thank for that. So I'm about to introduce him and let you know one of the four diplomates of the International College of Applied Kinesiology happen to be in the state of Florida, and Dr. J. Marienthal is one of them. If you are involved in an automobile trauma, if you're having any kind of health-related issue, and you're in the north part of Broward County or the south part of Palm Beach County, then you need to give Dr. J. Marienthal a call, and I'll introduce him now and let him explain to you what they do at their office. So without further ado, Dr. J. Marienthal.
Yep. Dr. Usriy, thank you so much. This is great to be here. It's fun.
Well, you're welcome.
And it's great hanging out with you because we don't get to do it enough as we used to. Every Tuesday morning we would study.
That's true.
And
That's true.
until we got our diplomates. So this is great.
Yeah, Dr. J is very busy. He's running a very successful practice. He does a lot of work for the International College of Applied Kinesiology, as I said, in the area of education. And he is a member of the Knights, and they have a lot of different meetings and get-togethers. So he's quite busy on top of being a father of two young girls. And I am lucky enough to get to see him once in a while. I was able to pull him from his routine by asking him to come on the show. So welcome. Why don't you tell us what you guys do over there at Dr. J Chiropractic?
All right. So, well, we are, like you, chiropractors. So that's my my designation and kind of, shall we say, it's our philosophy, what we center ourselves around. But what I think of as chiropractic is, one of the things I love about applied kinesiology is one of our tenets that we talk about in applied kinesiology is chemical, structural, and emotional. And the first chiropractor, the original guy named D.D. Palmer, he used to say toxins, thoughts, and traumas. And so, we really do try to bring all aspects of this into our treatment. So when somebody walks in with a headache, it can be an emotional issue, it can be a structural issue, or it can be a chemical issue. And so what we do is use muscle testing, we use laboratory testing, we use diagnostic testing, whether that's nerve conduction velocity studies or other kinds of things. And much like Dr. Usriy says, we try to rule out what's the functional things, the stuff that we can change through manipulation, soft tissue work, vitamins, nutrients, lifestyle modifications, and what is true pathology that you're seeing either a surgeon or a neurologist and we're pretty good at figuring these things out, especially the majority of the people I think that we really connect with and help the most are those people who are sitting in that donut hole of like, my doctor says there's nothing wrong with me, but I can tell you because I've been living in my body my whole life, something is definitely wrong. And it's like, yeah, your labs aren't really showing this. Your tests aren't really showing this. You're fine, but there's something wrong. And we can use our applied kinesiology and just other diagnostic tools to really figure out what are these functional issues. And a lot of times it's just a matter of, we can get creative. Sometimes it's having people do exercises. Sometimes it's having people look in certain directions. Sometimes it's about having people use different apps that have lines that go across the screen in certain directions to help them to kind of balance their brain. And sometimes it's, stuff that we can't do. But we try to do our best to figure out what it is we can and cannot do and do it well. And there's a lot that we can do. Some neat stuff.
As Dr. J says, as chiropractors in the state of Florida and applied kinesiologists, we are primary care physicians. So it's our job to find out whether you do have a condition that a medical doctor needs to address or whether, in fact, you do have a functional issue. We deal with functional neurology as applied kinesiologists. So if you have a biochemical or biomechanical problem, we are well trained in dealing with those matters, in addition to bioenergetics. Both Dr. J and myself are acupuncturists, so we work with the energy that flows through the body. Any areas of blockage or stagnation of energy that is not moving as it should, by utilizing this long storied health treatment and approach that's over 5,000 years old and quite successful in helping people reach a better level of health. So, if you're looking for acupuncture, if you have any kind of structural, biochemical, or energetic issue, that can be dealt with at Dr. J's office in the north part of Broward County and the south part of Palm Beach County. He's no more than 15 minutes away, right off of Hillsborough Boulevard, and I believe it's Northeast 2nd or Northwest
Yeah,
2nd?
Northeast, just
Northeast
east of
2nd.
Dixie.
Yeah, he can, from his office, you can see Hillsborough Boulevard. So I would encourage you to give Dr. J. Marienthal a call and make an appointment. Do you provide any kind of free time to evaluate a patient, or do you guys have specials at certain times where?
Sometimes we do, but for the most part, we do take certain insurances, and we can do a phone consultation for free. But usually by the time people are coming in, we usually do treat on the first visit, so that's kind of a real big positive. So a lot of times when people are coming in, they're walking out their first day feeling better. So that's one of our big things that we try to make sure everybody has their problems that they're coming in for addressed on the first
Well, that's
visit.
sure what we want. We want people to feel better
Yeah.
leaving than coming in.
Yeah.
And as you see, Dr. J does accept medical insurance. So why not give them a call and find out what you can expect on your first visit? And he has a great office staff there. They'll be more than happy to tell you everything from A to Z and what you can expect and what your responsibilities are. In the meantime, let me ask a couple of questions to Dr. J about any particular automobile trauma where not only was the patient injured, but other aspects of those injuries that we often hear about, but not everybody may experience, but some do and don't even mention it. Let's talk about what happens when a person's involved in this kind of trauma and it creates an emotional trauma, a fear based issue that stops this person from functioning normally. Can you share a story for us?
Yeah. So I have a story that I do want to share, but I think I want to talk about that more because I think that's something that is just overlooked just in life in general and in medicine in general. We have these things. One of the biggest books on trauma is called The Body Keeps the Score. We don't realize how much of what we go through affects us physically and continues to affect us physically. One of the things we talk about that we're with applied kinesiology. So I'm going to take a step back here and talk a little bit about what makes applied kinesiology a little bit different and what allows us to see things that other people necessarily can't. You can have an emotional issue that gets stored in the body. So let's say that you're going through a divorce and you get in this car accident and now you've got this neck pain. And a few years go by and you're in a new relationship and then you start having some marital issues again, and then all of a sudden your neck starts hurting. We can go after the neck and we can look at the neck, but if there's no real problem there, sometimes it's addressing the emotional issues that are tied in. It seems that we get these emotional issues that can be tied into the body. And the story we were talking about before the show is I had a patient, I think this was about a year ago, who had come in who had just been in a horrible car accident. She was driving along, I think 95, and car 2 cars over hit the car next to her, and the car made a sharp turn. Her car went up and over it, and she thinks her car flipped over 4 times. She doesn't even know how many, just kept flipping. And she landed at the end of this, and she didn't know where she was. She may or may not have lost consciousness, but she realized she was upside down when blood was dripping the wrong way. And so somebody then came through a window and cut the seatbelt and dragged her out. And she was hurt. She needed treatment. But the thing is, how do you get to treatment? You have to drive there, right? So she was terrified to drive. She couldn't get in a car. She couldn't drive. So at first she had to have her boyfriend driving her to the and anytime anything happened, she was just on such high alert. And and the first few treatments, other than looking for serious injuries, whether that's dislocations or fractures or abnormality of motion segments in the spine, one of the things that we really had to focus on was getting her to feel safe again, and not only getting her to feel safe while she's driving, but also just getting her to feel safe in life. I mean, she was going through this accident affected every aspect of her life. When we don't feel safe, you have certain signals in your body that get turned on and primed. It's almost like your brain is primed to look for any kind of predator activity going on. So the tiniest little ding of a glass is going to distract you and have you turning your head and losing your focus. Not to mention, if you have a brain injury, any kind of concussion, that's going to make it a lot harder for you to focus as well. So this accident bled into every aspect of her life for a very long time. So when we got her to where she could actually feel safe, or not even feel safe, but recognize that in this moment she was safe, then she was able to start to get into her car, and eventually got to where she could drive herself again, and got to where she was, I don't want to say healed from all of her injuries, because these things that happen, we don't necessarily see the long-term effects of them, but she was feeling really good by the time that she ended treatment, and able to go back to work, able to drive herself again without having panic attacks and having to pull the car over and cry and call people to come pick her up, which she had to do initially. But this stuff is really important. I mean, we go into, and when we have these traumatic events or effects of our body, or these are physiologic things that keep us alive. Fight. We've all heard of fight and flight. One of the big ones that people don't really know too much about is freeze and fawn. But freeze is a big one. When we have this physiologic effect of a freeze reaction, you'll see depression in your heart rate. You'll see depression of heart rate variability. You'll actually see physiologic signs of somebody unable to come out of it. And like I said, The Body Keeps the Score is a really good book. One of the things that Bessel van der Kolk in that book talks about, and I really like, there's a whole bunch of quotes from that book that I really like, but one of the ones is, it's very hard for people to take themselves out of that fight, flight, freeze. And I think it's really unreasonable to expect somebody to be able to pull themselves out of it. It's kind of like there's a movie from, I think it's the 70s, Airplane. There's a woman the plane is crashing, and she's like, I gotta get out of here. I gotta get out of here. And the guy next to her grabs her and shakes her and smacks her. And there's this progressively long line of people with more and more gruesome weapons to try to snap her out of it. But like, we as human beings need to be taken out of this stuff. And I think this is an underlooked part of accidents. Everybody that gets into that, you see some people, everybody has different reactions. Some people have fight reactions where they go into this, really aggressive. Some people go into a flight reaction where they're like, they got to get out and they got to go. Some people have freeze reactions where they sit. But I think, a lot of times when we first go through this car accident, we have this time of, just not being necessarily ourselves when we feel safe. And then we have this refractory period where we start to really feel a lot of stuff. And that's part of the day later, the few hours later. I didn't realize that my finger was broken until 2 hours later. And so,
What Dr. J is referring to, for those of you who have never heard of the autonomic nervous system, we have this fight or flight aspect of our nervous system that when we perceive a threat can occur when we're involved in an automobile accident and occurs quite frequently and can have a tremendous impact emotionally on patients and physiologically, how their organs function, how their ability to heal is impacted because they're stuck in what we call a sympathetic overdrive. For those of you who look at Facebook, you may have seen a book written by Dr. Porges who talks about the polyvagal theory. And this has everything to do with our autonomic nervous system. And Dr. Marienthal works with this quite a bit. He's had special training in emotional trauma, and many of the applied kinesiologists delve into this particular area of dysfunction in the nervous system. And it's all too common, aside from the physical injuries, these emotional injuries that occur to the brain. And if you're able to help that patient in that way, it can be miraculous. In some cases, when you're involved in an automobile trauma, it can be so impactful on you emotionally and physiologically, you just don't seem to get better. You don't respond to therapies. You're having a difficult time doing the activities of daily living. This is what's so important about seeing a chiropractor who has that specialized training, who can help you in areas you may not even have considered. And this happens to a lot of patients that go to applied kinesiologists. Yes, they're banged up. They have many problems that are directly the result of an automobile trauma, but many times they were suffering with other issues that they were rationalizing away or didn't seem to have time for or weren't hurting enough to motivate them to go see the doctor, but benefit as a result of the treatment that is far reaching above and beyond simply the automobile traumas, emotional and physical impact, but other chronic issues they may have been dealing with also seem to respond well to treatment. And the person ultimately ends up becoming a lifetime chiropractic patient. You know, if you love your dentist and your dentist does a good job, they're a lifetime practitioner for you. When you have a certain type of healthcare practitioner that meets your healthcare needs, sometimes without you even realizing that's what you needed, and now you start recognizing what it's like to function at optimal health, you just say, I'm not going to live my life at half mass any longer. I'm not going to live my life and just barely get by. I'm going to live my life to the fullest by having optimal health. And I know that that doctor who does applied kinesiology is helping me get there and reach my goal of feeling great all the time. Maybe you can share another story of someone who came to you with this trauma, but was also suffering from chronic issues, and you help turn
Yeah.
that around.
So it's funny, as we talk, like just there's faces that come into your head. I have not been in practice nearly as long as you, so I do not have the number of people. I've been in practice for 16 years, and I recently had a patient who, it's funny how these things happen and they get stuck in us, and we don't necessarily know. One of the things I was thinking as you were talking is how amazingly adaptive the human body is. And, we can have all these things that happen to us. We take all these hits, whether emotionally or chemically or physically, and we're fine. And then all of a sudden you bend over to pick up a piece of mail, or you sleep wrong, or you turn your head too fast, and then you throw your neck out, or you throw your back out, and what I think of it when these are the cases is we can adapt, and then we adapt to our adaptations and we compensate, and then we adapt to our adaptations and we compensate. And it's not until your body just can't adapt anymore that the straw breaks the camel's back, so to say. And so what we try to do with applied kinesiology, just with what I do with is find these adaptations and find these things that you think, yeah, this is normal, this is fine, this is the way I've always been. But it's like, you haven't always been this way. This is an adaptation to your, and so it's kind of like I always explain this like imagine a Jenga tower that's like gnarled and going left and right in all these different directions. If you were to go in and just kind of be like, oh, look at this bottom one, it's off to the left here, let's just push it back in, you end up having the whole tower fall. What we need to do is systematically and use our best attempt to try not to destabilize the whole system, but piece by piece, kind of organize this tower of dysfunction. Um, the story that I thought of was a woman who came in recently with a car accident who injured her elbow, and so she's been having all this elbow pain, and so we use a technique with her called neuro-emotional technique. And with neuro-emotional technique, there's a great movie or a documentary you can watch on that called Stressed. And they just show all the science and research that it shows functional MRIs that help to make changes in the brain when we go through asking questions in a certain way and using acupuncture points and acupuncture meridians to assess different emotions and where they're stored and how they're stored. And as we started going through these different problems with her left elbow, or right elbow, excuse me, with her elbow problem, it ended up being an emotional issue. And it was tied to a time where she was going through a divorce and she was having problems with her ex and all these different things. And she had this big emotional explosion, and she felt instantly, without me doing any kind of muscle work or any kind of adjusting to her elbow, it's like this elbow pain got significantly better. But that was just a layer, right? That was just one layer. So then she comes in the next visit, and now we can do more muscle work on her, on the extensor, individual, extensor indices and the extensor digitorum longus, all these different individual muscles that needed muscle work and fascial work and acupuncture and using a laser on it. And I just saw her today, and she's like, man, my elbow's, 10% of what it used to be. And it's a moving target. These things are not always easy to fix because there's a lot of things that are involved in it, But
Another chiropractic success story.
yeah. I mean, and the funny thing is how hard it is to find these things because they're buried down deep. There's a field of study called somatic therapy by Peter Levine, who is a psychologist and a Rolfer, which is a type of massage. And there's a story that he talks about where there's a person who was in this horrible accident or witnessed a horrible accident, and they walked into they see this car that's rolled over all these times, and this guy reaches into the car to turn the car off because he's afraid it was going to explode. There's all these different things, and as he reaches in, he sees the passenger had been decapitated. And after that, he ended up with a shoulder problem, and he went to the ortho, and they take the MRIs and they did the X-rays, and everything was normal, everything was fine. He's been getting treated, but then when he went to this somatic therapy, somatic experiencing therapy, they're having him go through these different emotions. And as he's walking in and reliving these events. And that's one of the things that we do is actually have people go through these things and relive these events. And what we find is that, for the first time in years, his shoulder pain just went away. And I've seen the same thing happen with all kinds of things. And it's funny we've gotten into the emotional side of things, which I think is a really important part of all these different things.
I
And
agree
it's
with
easy
you.
to talk about because what we really excel at with applied kinesiology is really finding the minutia. I mean, there's almost no other way other than a needle, a nerve conduction velocity, where we can go in and we can say, okay, this spot right here is where you have these different problems. And I don't even know anybody that's checking the difference between one area of a muscle along
Applied kinesiologists.
yeah. And so we can really hone in. Look, one of the areas we're strongest is with this physical medicine side, but tying the emotional end of these things into this is just it's a needed piece, I think.
Well, I think back to what you said at the beginning of the show, how Dee Dee Palmer talked about emotions, toxins, and structural issues. And if we look at this triad here, we can see this is all on one side of the triangle of health. These are the interruptions that cause problems in people's health. This was taught to me by Dr. John Brimhall, one of my first mentors, who was one of the original applied kinesiologists being trained under Dr. Goodhart at the beginning of applied kinesiology in the 60s. And he was citing the theory that D.D. Palmer had in 1892. So once you're telling and you're on the road of a truth, no matter how much time evolves, as technology becomes more and more part of healthcare, we realize that these basic truths that Dr. Palmer had are being realized a number of years later, over 100 years. The
Is that
truth is the truth, and chiropractors have been doing that since 1892, and applied kinesiologists since the 60s.
there's a thing that George Goodhart, the guy who started applied kinesiology, and I think this is a Jesuit saying, but what exists persists, and what persists exists.
We can always count on something from Dr. J. He's very deep and philosophical.
Yeah. But it's true. I mean, this is what we aim to do is try to just observe, right? We become very good observationalists, and we also try to learn from our past observations and mistakes and successes, and say, okay, when we see this, sometimes it might mean this, and let's try this out and see. And I think to a large extent we understand the body, but I think to an even larger extent we really don't know exactly quite how the body works.
But that curiosity that says, I wonder why that is, enables us to break through these puzzles and solve them and help patients where they just have had this frustrating road where they haven't been helped. They'll go see this medical doctor and that medical doctor. And one of the reasons they're not helped is they don't have a disease or a pathology that's brewing in their body. They have a functional issue, and it really does take the right person to unlock that mystery and solve it and treat it properly.
Yeah, and these things aren't always easy. Sometimes they're hard to find.
This is true. This is true. Well, I want to thank you very much for joining me today. It's been a plethora of subjects that we've talked about, from physical traumas to emotional traumas to issues that can affect things in our body that we had no idea had their origin in our brains. And this is why the nervous system function of the body is so important. I do want to let everybody in the audience know Dr. Marienthal of Marienthal Chiropractic is available for your healthcare needs, whatever they may be. If you're suffering with a problem, there's no need for that. Give them a call over at Marienthal Chiropractic. He's located right in the north area of Broward County, and let's find out if Dr. J can help your problem by giving him a call and making an appointment. And as usual, you can come to All American Wellness Center. We offer a free 15-minute functional evaluation. Whatever your problem is, don't suffer with it. Don't come up with a rationalization of why you have it and how it's going to take care of itself. It never does. It only gets worse as time goes on. So by all means, take care of yourself. Be good to yourself. Come in, spend a little time and find out, and knowledge is power, and find out what options you have to help your issues. You don't have to suffer with subnormal health. You can have optimal health by getting in touch with one of these fine kinesiologists. Two of them are on the microphone right in front of you, telling you to come in and enjoy optimal health. This has been Dr. Usriy and Dr. J. Marienthal from All About Health, and we urge you to give us a call. You can find us on Spotify, on Apple, on Facebook, and on YouTube, and I encourage you to look for our show. It's on every week. Unfortunately, we don't have the honor of having Dr. Marienthal here at every show, but be sure and take advantage of the time that he has spent here to acquaint you with what applied kinesiologists do, and give them a call over there. In the meantime, I thank you very much for joining us. I thank you very much, Dr. Marienthal. I appreciate your valuable time. And I wish everybody in our audience a wonderful, wonderful week until we see each other again. This is Dr. Usriy from All American Wellness and all about health and wellness. Bye bye for now.
It's been a pleasure.